Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television, from the Helping Seniors Network of information, education, and resources.
So what I love about Tami and her company, Practitioners in Motion, is they go to you, and we could spend the rest of the time here just talking about the benefit, because I don't know if you ever go to a doctor's office, and I mean a good doctor's office, you're still lucky to have like 8 minutes with the actual doctor, right? Because everybody comes in, they ask you your medications, they ask you what's changed, they try to write all this stuff down, they're trying to help the doctor, but the time that you have with the doctor is like this much. And then the other problem is, I was laughing because I was telling Tami this story. When we were caregivers for our moms, they would complain at home all week. Like, I feel terrible. This is awful. I've got this pain. I've got this. And then the morning that we go to the doctor's office, everybody's showered. They're looking good. We get in the car. We get there. Doc walks in. How you doing? I'm fine. And so one of the cool things is because they work, they go to where you are. And so because of that, it puts, first of all, the person's more at ease because they're in their home environment. And then also it gives the practitioners an opportunity to see what's really a better overall sense of what's going on. So when it came up for HeartSmart, I said, this is the perfect thing if you would come and help us and lead us through and learn things that we need to know. Because again, job number one on the aging plan is let's stay healthy. So with that, can I turn it over to you? Thank you, Tami.
I'm going to bring him everywhere I go. That was an awesome intro. So as he said, my name is Tami Leeberg. I'm a co-owner of Practitioners in Motion. My sister and I opened the company up 9 years next month. So she was a provider with Health First, and I actually had a practice in Indiana, and I moved back. And we decided to open it up because both of us were doing regular office, seeing patients in the office, and the companies were wanting us to, see our patients very quickly for one thing. So if you came in just for, a cough, but say your arthritis is flared up that day, they wanted us to have you schedule another appointment for the arthritis pain. And we were like, we can't do that with our geriatric population. Most of us after a certain age have more than one thing going on. And even if you're healthy, you still need to make sure you get your routine labs done and things like that, because to stay healthy the longest is preventative medicine, and so we both opened that up. It started with me and her. We're both board certified adult and geriatrician nurse practitioners. We are autonomous, and that confuses a lot of people, so we don't have a physician that we have to work under. We're by ourselves. It started out with me and her and our MA. And our MA's Gidget, she's been with us, she's worked with Christy somewhere since like 1999. So when we broke off, she came with us. We're up to 10 providers now, and we have an office staff of 5. My nurse is Jean. She's over there. Anybody that wants their blood pressure checked today, she'll be more than happy to do that for you when we're all done here. So Kerry what we do is we go to assisted livings and private homes. And independent living communities. We see all of our patients once a month. It's called chronic care management, whether you're sick or healthy. So we come to you, we do an assessment, we chit chat. As Kerry pointed out, it gives us a clearer view of what's going on. We've gone to many homes before, and they didn't have food in the refrigerator, or as soon as you walk in, it's like, well, we've got to do a urine sample because obviously there's something going on here that, and you don't get that in the office. Like Kerry said, everybody that comes in, all of a sudden they're fine. It's a good day and everything's okay. So it gives us a real basis of how people are actually living. A lot of people, as they get older, I've had patients that have chosen to buy food for their animal, and they're losing weight, and it's like, why are you losing weight? She actually was sharing cat food with her cat because that's all she could afford. So then that way we can get social services involved and other resources, when they need it, and they're not going to tell you that when they come into the office. So We go out through from Brevard County, and we're down into Indian River County now also. We see about 92 facilities and then a lot of private homes now. So that's what our company does. What he asked me to do, by trade, I'm an ER and a cardiovascular ICU nurse, so I did that for 23 years before I went back out and got my provider's license. So he asked me to talk to you about heart health, February being Heart Health Month. So I was going to talk to you all about high blood pressure, because that's something that over time the majority of people end up having issues with. And then at the end, we'll just do a question and answer, if that's okay with y'all. So there's 3 stages of blood pressures. Well, let me go back. So blood pressure, a lot of people think, oh, well, they only worry about the top number. So, oh, my blood pressure is good, it's 130. So there's 2 ways of measuring that. So the blood pressure is the amount of force it takes for your heart to pump and the resistance it gets in the arteries when it is pumping. So you've got 2 numbers. Your top number is going to be your systolic number, and that is when your bottom chamber of your heart is actually pumping out the blood. That's the number that we're looking at. The bottom number is called the diastolic number. That number is actually extremely important also, because that's when your heart is actually at rest. So if your numbers are running, high 80s, 90s or worse, when your heart is at rest, you can just imagine what it's trying to do when it's trying to pump that. So the 2 things that, there are 3 stages. A lot of times you'll get your doctor's note and it'll say like stage 3B. And so we'll have a lot of patients say, well, what does that mean? It says high blood pressure, stage 3B. So there's actually 3 stages. The first stage is anything that's consistently, the top number is 130 to 139. And that's a new range. The newest research just came out. Everybody used to think it was like 120 over 70s. That was the golden number. So they've raised that somewhat. So now it's 130 to 139. Bottom number being 80 to 89. And again, this is consistent. So if you're not feeling well or you're in pain, your number may be higher, but it's going to be, you need to trend those out. So it's a consistent number. So like when I get a new patient, when they're first admitted to me, I will have the nurses or the staff there do blood pressures once or twice a day, depending on the patient, for 2 weeks. That way, when I go back, that I can see what it is doing over a 2-week period, and that way we can titrate medicine or start them if needed. The second stage is a consistent pressure of 140 over 90s, and then you have what's called a hypertensive crisis. That's anything that exceeds 180 over 120. Again, if your numbers are that high, you need to wait, drink some water, be calm, sit down, check it again in 5 minutes. If you're still running that high, it's an emergency. You need to go to the emergency department. And then the other thing too is you want to take your blood pressure at the same time of the day. If you're on blood pressure medicine, some people take it once or twice or once a day. If you take blood pressure again in the evening, you don't have to do it routinely, but several times a month, you're going to want to check that nighttime pressure too, just to make sure that you're staying consistent throughout the day. Obviously, if you have anything that is chest pain, high jaw or neck pain, back pain, especially for females, or if you are extremely fatigued for several days in a row, like an abnormally amount of tiredness, those are things that need to be checked out right away. Chest pain, shortness of breath, anything like that, that's an emergency visit also. So a lot of females have different symptoms when it comes to having any kind of cardiac issues. We have can have nausea. We have more pain in our backs usually than the typical jaw and neck pain that you hear about on shows and TVs. So anything that's abnormal, especially a lot of people will think, oh, it's just heartburn, especially ladies. That heartburn is a sign that you need to have your doctor check you out for things. And you have to remember too, one of the things is when you go in for a routine exam, like when your doctor's doing routine blood work, I've heard a lot of people say, well, how could it be my heart? I was just checked out last month and I was told it was fine. When we do routine lab work and things, we're checking your blood count, your electrolytes, your kidneys, your liver. We're not doing a cardiac workup. That's going to be a separate kind of a workup. And anyone that starts to have any kind of heart disease needs, even if you see your primary monthly like ours, we collaborate with cardiologists a lot, and we make sure that you're seeing them at least twice a year if you have any kind of heart issues. So I've had patients come to me, it's like, oh yeah, I had a stent put in 5 years ago and have never been back to see their heart doctor because everything's been okay. So those checkups need to be followed up on if you have any kind of cardiovascular issues. The causes of blood pressure, again, is about the force up in the arteries. So there's primary hypertension, which usually develops over time, many years. There's plaque that builds up in your arteries become harder. So it's just like, if you think of a hose, when you try to get the water through it, you know, if you have a really stiff hose, that pressure is going to come out harder. That's the same thing with your blood pressure. If you have a more limber, pliable hose, the water easier trickle. That's kind of how to think of it as it's going through your body. And then there's secondary hypertension, which is caused by other underlying conditions like that. Let's see, it can also be from cold medicines. That's one thing, especially if you're on blood pressure medications, which I'm sure our pharmacist will talk about with hers. The polypharmacy thing is very real. So, and everybody thinks, oh, it's over the counter. That doesn't mean that it's safe for everybody. So that's one thing you want to make sure if you're on blood pressure medicine or have issues that you're taking that medication, the cold medicine that's made for blood pressure patients, because that is out there. You don't want a regular cold medicine, or like Sudafed, anything that's going to raise that. You don't want to add to that with over-the-counter medications. Risk factors for blood pressure is age, obviously, race, any family history, obesity, being overweight, and that can just be even like 15 pounds overweight. That's going to, the more, again, difficult it is for you to pump that blood through your body, then the higher your blood pressure can be. And just losing 10 or 15 pounds can make a tremendous effect on your blood pressure and your cardiovascular status overall. The other things I'm just going to go through and then I'll go back and talk about, but it's lack of exercise, any kind of tobacco use or vaping, too much salt, low potassium levels, which is another reason we always check electrolytes every 3 months, because those things could definitely affect blood pressure overall. Drinking too much alcohol, high stress levels, and then other conditions like we talked about, kidney disease, diabetes, and sleep apnea. Sleep apnea is one of the other things I want to touch on quickly, because that's very underdiagnosed, and it can play a huge factor in your overall health, your fatigue, your blood pressure, swelling in your legs. There's many factors that sleep apnea can affect, and they do have a lot of newer, in the last decade, treatments for that can help you, and you would be amazed how better you will feel if you get that treated. And a pulmonologist can do that, so your doctor can refer you out to a pulmonologist and get that testing done. So if you have any kind of, if your partner tells you, oh, you stop breathing in the middle of the night, or you do one of the really bad snoring things like that, those are reasons to get checked out to see if you have sleep apnea. Getting enough exercise. That's the one word that most of us don't want to hear, me included. So they say that 150 minutes of moderate aerobic exercise per week, which is 20 to 30 minutes per day, will help maintain an overall health. It will help decrease your cortisol levels, which decreases the stress that your body has on it. Some days I can't get 5 minutes to do like an aerobic exercise. So what I always, and as we get older, our arthritis hurts, our joints hurt, it's harder to get out and move about. But if you do 5 or 10 minutes of just walking, which is a simple thing to do most of the time, even if you're using your walker or whatnot, if you get out, even if it's around your house, or if you can get out to the mall. Most of my patients have a very difficult time getting in and out of vehicles and things. I do a lot of memory care dementia patients, but we still need to get them out and walk them around their facility and get them moving. And if you do that 5 or 10 minutes, 3 or 4 times throughout the day instead of all at once, that's going to give you the same amount of benefit as if you're out on a treadmill for 30 minutes at a time. So when you think about exercise, you don't have to think about actually lifting weights or breaking that sweat. Just getting up and moving for that 20 to 30 minutes a day, 5 days a week, is going to be hugely beneficial for you. And then that will let you know that when Jeetal is here next month with Coastal Occupational Therapy, we use her a lot. She does Part B, outpatient therapies, and she's phenomenal. I've even sent her to my dad. That's how much I trust her. So if you can make her talk next month, please come back and do that. So, and she'll go over all kind of different exercises with you that you can do in a seated chair that's going to give you a benefit for your overall health. And then obviously if you smoke, you should stop. That does cause the arteries to narrow. It does cause the wall of the arteries to stiffen over time. So, and even if you've smoked for, I had one guy say, well, I've smoked for 40 years. There's no reason to quit now. That isn't true. If you stop, the benefits will kick in over time. So, obviously eating good foods. This handout also I've made copies for is back on our table, so I'm not going to sit here and read all the foods off to you, but there are foods that can help naturally lower blood pressure and help the pliability of your arteries improve. And then, let's see what else. Okay. So I wanted to go over also, if you have a condition called atrial fib, which is an irregular heartbeat, a lot of times your doctor will say, take your blood pressure once a day, go get a cuff and just do it at home. If you have atrial fib, the cuff monitors that they sell, those are not accurate if you have an irregular heartbeat. They're either going to read too high or too low, or they're going to pick up extra beats or not pick up enough beats, just because they're not made to, even with all the smart technology we have, they're not made to catch that. So if you have atrial fib or any kind of irregular heartbeat arrhythmia, you'll need to get an arm cuff that comes at the top. And when you do that, you want to make sure that your legs are uncrossed, you're at a seated position, and you don't move, because any little movement in those automatic cuffs will make it seem higher than it is, and it won't give you an accurate reading. So it's very important not to move around. Don't even talk while the machine's thinking, and that's going to give you your most accurate readings that way. Obviously, I've been a nurse forever, so old school. The very most accurate is a manual pressure. If you can, if you go into your doctor, or even I think urgent cares might do blood pressures for you. I'm not sure if they do that here. They did in Indiana, but if you can get someone to do a manual blood pressure on you, that's the most accurate way. But I know at home that's not feasible. So an arm cuff, they do cost a little bit more, but they are much more accurate than the wrist cuffs are. I talked a lot about high blood pressure, but what about low blood pressure, she's asking. So if you're having low blood pressure and you're on medication, obvious for high blood pressure, and again, this is something that happens a lot. So as a primary, I feel like and this is when I bring on new practitioners with our group, when I'm training, this is one of the things, I look at us like the cog in a wheel. So you've got your cardiologist out here, you might have a kidney doctor, you've got your pharmacy, you've got a lot of people on the outside. Your primary should be that cog. Now, a lot of times in an office, they don't have the time that we can have, not in an office, and I get that. But it really is their job. It is what they should be doing, is to check that med list every time you go into them. Take a med list with you and say, this is what I'm actually taking. Because a lot of times that heart doctor, they won't get that note, or they'll miss it, or the kidney doctor starts you on something and they won't. So to answer that in the long way, if you're on medication and you're running low, then that needs to be brought up to your primary right away and just say, I've been running low for the last so many days, I'm on this drug, what do you want me to do? And they're probably going to titrate you down. So, and my theory always is less is more. So I'll get patients that come from the hospital with 3 pages of meds, and the first thing I do is order lab work to check a baseline labs, and that second follow-up visit in a week, I usually start getting them off drugs. So, and they feel a lot better because, like Kerry had mentioned, you're on one drug for this, and then you have a side effect, so then you get another drug for the side effect, and then that has side effect. So everything you put into your body has a potential side effect. So you might be on 2 drugs at the same time that maybe they don't even know you're on that's causing that. If you're not on medication for high blood pressure and you're still running low, one of the main reasons that we run low, especially as we get older, is that we're dehydrated. Most of us walk around in a dehydrated state when we're older, and they're no, I drink 2 glasses of water a day. The goal is whatever your weight is, half of that. So if you're 100 pounds, you would want to drink 50 ounces of water a day. So half your weight and that many ounces of water. Now, obviously, if you have congestive heart failure or a kidney issue where you're on a limited amount, that's going to make a difference. But the number one cause of low blood pressure in adults is dehydration. Well, so if you're not symptomatic and you run we like 100. Anything under 100, I start thinking, let's start checking things. So, and as far as the bottom number, it's usually good around 60 to 70. That's like the sweet spot, so to speak. So if you're running that, then those are okay. Any numbers under that, then you should start looking at and trending out. But if you're symptomatic, then you need to do something sooner than that. There's several different foods there on the handout that'll talk about that, but bananas is the number one easiest thing you can eat that has a very high potassium rate. But again, those numbers for your sodium and your body needs salt. Sodium and potassium are the main electrolytes that kind of run everything in your system. So even though they say low sodium, you still do need salt in your diet. But a lot of times, especially if you have swelling in your legs, that's going to be one of the things they look at. But again, when they do your routine lab work, which should be done every 3 months, 6 if you're really healthy, there's a range there that we'll be looking at. A lot of times potassium will be higher if you're having any kind of kidney issues, and then there's a lot of medications that can raise your potassium level. Doesn't matter what your diet is, so that's the reason those need checked. Yeah, it's 130 to 139 for the top number for stage 1. And then consistently 140 over 90 for stage 2. And then they're broken out after that, but that's your basic numbers. And then anything over, I think it's 180 over 120 is considered a hypertensive crisis. So between 140 over 90s up to 180 would be that 3A, and there's a 3B. Anything that that falls below 92% consistently needs to be looked at. Now, we use the finger monitors. I know they sell them everywhere, and you can check those. The thing with those, you have to those work by your heart rate. So again, if you have an irregular heart rate, that may not be accurate, or you may have to leave it on your finger a lot longer. It also may run low if you're wearing fingernail polish. It's difficult for it because it works on the capillaries, and that polish covers that. Or fake nails, or if you're cold. If your fingers are cold, it definitely will not give you a correct reading. So if you're getting something low like that and you're like, I don't feel bad, I don't feel short of air, make sure your hands are warmed up and then let it sit there. A lot of people will put it on and be like, oh, it's 88. No, let it sit. It's got to get your heartbeat and has to think about it for a minute. So, but if you do all those things and you're still running under 92, it's a reason to be looked at. If you're in the 80s, you need to call your doctor and be seen. about heart murmurs. The heart murmur, so you've got valves, 3 valves in your heart, and each one of those, if it starts to get, I'm being cut off. No, you're okay. Each one of those has for better words, it's a flap. So when your blood goes through it, it opens. Blood goes through, stops, and it stops. When you have a heart murmur, one of those leaflets gets loose. So then the blood doesn't just go through and stop, it comes back up. So some heart murmurs are, you can have one, you'll never know it, you'll never have symptoms, you'll never need anything. Other murmurs start backflowing so much that you end up getting congestive heart failure or pulmonary hypertension, things like that. So some need treated, some don't. If they get bad enough where you need a valve replacement, then, but it depends which valve it is also.
A couple of questions I'm going to ask Tami about afterwards. You know, we see these commercials all the time on TV that says, oh, you can check your heart with the little thing. Do you like those? Not like those? No, these are supposedly, you know, you. Yeah, $99. Put your finger on this. Hang on, come up, because this was one I was personally curious about. I see the ads. I go, is it real? Is it useful? What is it?
Yeah, they do an EKG machine off of your finger or something. I've used a few of those. They've come up okay. But if it comes up that you have an irregular heart rate, or if it says you have AFib, I mean, the only way to truly know if you have an arrhythmia that lasts is to do a lot of measurements off a 12-lead EKG. So that might give you a quick, this might be wrong with you, and you could go to get it checked out, but I wouldn't count on it being completely accurate either. So.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.